Hello everyone, welcome to my YouTube channel. Today we'll be talking about Polycystic Ovarian Syndrome. For short, it is known as PCOS. Okay, if you are new to this channel and you are yet to subscribe, please kindly hit the subscribe button. If you are a returning viewer and you've also not subscribed, please hit the subscribe button to enable you get notification from us when a new video is up. So back to the topic of discussion. Polycystic ovarian syndrome is a syndrome because it's a collection of many disorders in the body, and it affects the female gender mostly. It doesn't affect the male gender, it affects only the female gender. It is a hormonal disorder in women in their reproductive age. Polycystic ovarian syndrome affects the ovaries and ovulation. It causes hormonal imbalance, which causes irregular menses or menstrual period for most individuals with it, therefore making pregnancy difficult. So individuals with polycystic ovarian syndrome, they find it very difficult to get pregnant because this particular syndrome affects ovulation and the ovaries. Polycystic ovarian syndrome affects the woman's ovary. It affects by affecting the ovaries now, it affects the production of progesterone and estrogen. These are the two hormones that regulate menstruation, and once these two hormones are affected, you then know that the menstrual cycle of that woman will be either irregular or there will be absence of it. The three major features of polycystic ovarian syndrome include: one, there will be cysts in the ovary. By cyst in the ovary, this polycystic ovarian syndrome, a cyst is a fluid-filled sac, and they grow right inside the ovary. As they are growing right inside the ovaries, they are usually small and plenty growing in the ovaries. When this happens, it hampers the production of the estrogen and the progesterone, like I earlier stated. It doesn't only affect this, it affects the follicle stimulating hormones, and it also affects the luteinizing hormones, and these are major hormones that are being produced by the ovaries, and their regulation is from the brain too. So by affecting the ovaries affecting them in the ovaries, it also go a long way to send signals to the brain, which further affect the menstrual cycle of the individuals. Then the second feature of polycystic ovarian syndrome is high level of male hormone. The male hormone we all know is androgens, and these androgens are the hormones that are responsible for the male characteristics we know. For example, the baldness in men is as a result of this hormone. Also, the excess hair growth in men is attributed to androgens. Women who have polycystic ovarian syndrome tend to have an increased level of androgen. The last and major feature of polycystic ovarian syndrome is irregular period or menstruation, which I already stated from the earlier point when I was trying to introduce the topic of discussion for today. So I told you that, let me just do a recap of the three major features. The three major features I said is: one, cysts in the ovaries; high level of male hormones, which are the androgens; and the third is irregular period. So the exact cause of polycystic ovarian syndrome is not known, although it is believed that high level of male hormones is said to prevent the ovaries from the production of its hormones. And the hormones for women, I told you, is progesterone and estrogen. And once there's a surge in the male hormone, which is the androgens. The androgens now tend to suppress the production of those basic hormones that the woman needs, and these are the hormones that are responsible for menstruation. Now, the factors that can be linked to excess production of androgens. One, we have hereditary or gene. For individuals that have a particular gene in them that is coding for a high production of this androgen, they tend to have increase, and with this increase now, it also affects the ovaries in the production of those other hormones I mentioned, progesterone and estrogen. Then another factor that can be linked to increase in androgen in a woman is insulin resistance. By insulin resistance, it means the cells of the woman cannot utilize insulin. And insulin, we all know, is a hormone that is responsible for breaking down the food we eat, that's sugar, to help us utilize it properly. And this is what most of those diabetic individuals lack. And insulin resistance, it means the body cannot properly use it, one. Then this makes, and the individual definitely have to eat. So the more you eat, the more the insulin in the body increases. And once this insulin in the body increases, it then triggers the production of what? This androgen. So excess insulin triggers the release of excess androgen. So this is another factor that can be linked to increase in androgens in an individual. The last two factors I'll be talking about is inflammation or obesity. An individual that is obese have insulin resistance, and this insulin resistance, like I said earlier, once there's insulin resistance, the individual will not stop eating. You keep eating, and the level of insulin keeps building up in your body. And if it keeps building up in your body, it then further increase in insulin further triggers in the production of androgens. So with these 3 to 4 factors that I have mentioned here, it will then trigger the release of more androgens into the system of the woman, therefore making her situation worse. So now the next subtopic we'll be moving on to here is the common symptoms of polycystic ovarian syndrome. One of it is irregular period or menses. Individuals with polycystic ovarian syndrome will not get the normal menstrual bleeding like others would do. Why? Because the ovaries are being suppressed. They cannot release estrogen and progesterone, and androgens are high in such individuals, making the period irregular or even absence of it. Then another one is heavy bleeding. If those individuals would get their period, it might be once in a while, and if it's coming, it will be very heavy. Why? Because there's a build up in the endometrial lining. We know that menstrual bleeding is not just normal blood coming out from us. We know that menstrual bleeding is as a result of the shedding of the uterine lining, which is the endometrium. And build up of this endometrial lining, if individuals do not have their menstrual period as often as they should, if it takes 3 to 4 months, then those lining that are supposed to have gone off, it tends to build up, and when it's time for them to see their period, it will then shed and making the bleeding heavy and even more. The next point is hair growth. Individuals with polycystic ovarian syndrome tend to have hair growing on their face and on their body. Some you see them with hair on their chest, on their back, as if they are male. So these are one of what this androgen does. I told you androgen is the hormone that is responsible for the male characteristics in men, and once you're having it in a woman, it then alters the normal physique of that woman. She might even start having this deep baritone voice as a result of this androgen. The next here is acne. Individuals with polycystic ovarian syndrome tend to have a more oily skin. This oily skin is due to androgen. This androgen acts on the skin. It tends to increase oil in the skin, making the skin more oily. Then they tend to be this. The next point is darkening of the skin. It is another common symptoms that individuals with polycystic ovarian syndrome tend to experience. Then the last symptom here is headache. They tend to have persistent headache that does not easily go. How it affects the body? How does polycystic ovarian syndrome affect the body? One of it is infertility. I clearly mentioned that once estrogen and progesterone is not produced as it should, they tend to be lack of ovulation, and this lack of ovulation makes it difficult for the individuals to get pregnant. So if on the long run this particular syndrome is not being addressed, it will cause infertility to that woman. The next is metabolic syndrome. By metabolic syndrome, this polycystic ovarian syndrome increases the risk of individuals with it to develop heart diseases, diabetes, and even stroke if not properly managed. The next is sleep apnea. Individuals with polycystic ovarian syndrome, when they go to sleep at night, they would tend to they report with frequent episode of breathlessness at night, which is not supposed to be. But these are how this can affect, like a long run complication of this syndrome. The next one is endometrial cancer. This endometrial cancer, it is due to the buildup of the endometrial lining. Individuals with polycystic ovarian syndrome will not get their period frequently, or there might be absence of it, and excess buildup of this endometrial lining can cause metastasis and tend to hamper the causing cell mutation, which will further lead to this cancer, endometrial cancer. So if you have polycystic ovarian syndrome with those symptoms that I've mentioned, please you go visit your doctor to avoid or cut down the risk of you coming down with endometrial cancer. The next way polycystic ovarian syndrome affects the individual is depression. By depression, how this affects the individual is these hormonal changes and the presence of facial hair and hair around the body in absurd area where it's not supposed to be, for a woman tend to have a negative feeling or gives the person a negative emotion about themselves, how they look or they perceive themselves. They don't like it, and usually it affects them psychologically, and even for most individuals it make them depressed. So these are the complications of polycystic ovarian syndrome. And if the depression is not well managed, most individuals with depression, it is very easy for them to be suicidal. Why am I like this? Why am I like this? I don't like myself. And they might just want to end it. So please, you need to get treated before it gets to this stage. The next and the last thing we'll be talking about polycystic ovarian syndrome is the medication. What can I take to help reduce this symptom of polycystic ovarian syndrome? One of it is birth control pills. By birth control pills, I mean you take progestin daily. The medication for polycystic ovarian syndrome is one, birth control pills. Birth control pills, example of it is progestin. You be on progestin daily, as it will help you restore your period, regulate ovulation, prevent endometrial cancer, and also relieve excess hair growth. This is what this birth control pills will do, because it tends to, because of the excess production of androgen, we are trying to use an agent that would help us counteract the effect of those androgen by increasing your intake of that female hormone that would help you generate or produce a symptom or the feeling of a more female-like characteristics. So this will help you bring back your menstruation, regulate the ovulation. You start getting your ovulation regularly, then it will prevent endometrial cancer and also relieve the excess hair growth that you'll be getting. The next drug of treatment for this polycystic ovarian syndrome is metformin. This metformin is meant to take care of type 2 diabetes. For individuals with polycystic ovarian syndrome, most 80% of them are usually obese, and these tend to have what? Insulin resistance. They have insulin resistance, and with this metformin, it will help them regulate or tackle that area of insulin resistance, helping them to further control type 2 diabetes. Then the next drug of action here is clomiphene. Clomiphene is a fertility drug. Individuals with polycystic ovarian syndrome who want to have babies can still do, but with the help of clomiphene. If you take clomiphene, studies have shown that it has the possibility of making such an individual have twin or multiple births. That's, you not just have, you have a twin gestation, or you'd even have more than a twin gestation, maybe a triplet or a quadruplet, depending on how it is being taken. So it is possible for individuals with polycystic ovarian syndrome to have babies with the help of clomiphene, which is a fertility drug. Then the next is hair removal medication. Hair removal medication such as eflonitine. Eflonitine cream is very important in removing those excessive hairs that you are having. This, what it does is you apply it on the face because individuals with polycystic ovarian syndrome tend to have a lot of facial hair. They have most of them even have mustache, but it's just that before they come out, they tend to take out those hair. So with eflonitine, you would take off those excess hair that you have. Then the last option, the last resort you can run to, if all these four mentioned medications are not working for you, is surgery. You book an appointment with your doctor and you'll be scheduled for a surgery. This surgery now is the surgery would be on the ovaries. They tend to take out those cysts from it, because those cysts is what is suppressing the estrogen and progesterone and increasing the level of androgen. So by taking out those cysts, the body tends to become normal and the individuals become fine. So I hope this video has been helpful to you. If you have not subscribed, please kindly hit the subscribe button, and you can do well to like this video, drop a comment. I don't mind. I seriously appreciate it if you do. And also, thank you for watching this video. See you next time.